Hi, my name is Jacqueline Cosgrove. I'm the health reporter at the Oklahoman, and I'm joined today in the studio by Scott Singleton. He is a board-certified behavioral analyst and also the Good Shepherd clinical director and a University of Central Oklahoma assistant psychology professor. We're going to be discussing the debate over over mandating insurance for autism coverage for therapies for autism, and we're joined via Google Hangout by two other folks, Jonathan Small, who is Executive Vice President of the Oklahoma Council on Public Affairs, and Judith Ursetti, who is the Director of State Government Affairs at Autism Speaks. So thank you guys all for joining us, both in person and online.
You're welcome.
Thank you.
So
Thank you.
what I hope we could first discuss, my question is for you, Scott. I was hoping you could explain, one of the things that we were talking about, obviously, is applied behavioral analysis therapy, something that experts have said works well for children with autism. Right. I was hoping you could kind of explain for folks who aren't familiar what that therapy is.
Well, the applied behavior analysis therapy is based on behavior science. And it's the application of the behavior science that has taught us a lot about how people learn and also what their motivations are. And so we've been able to use that research, decades of research, to really pinpoint different techniques that can help people learn a variety of new skills. It's helped people with a range of different issues, from smoking to anxiety, just a wide array of different skills, but of course particularly it's been effective for children with autism.
So if we were to come into your classroom, what might we see in terms of like you working with the kids with autism?
Well, we start off with a comprehensive assessment of their learning and their motivations, and from that we kind of see what their strengths and weaknesses are. We look at what skills they already have in place and then what skills they really need to learn. And we actually break down the skills one by one, and we teach them in very small steps. We use a lot of positive reinforcement to make sure that the kids associate all of these new skills with really positive outcomes. So when they come in, we'll do that assessment, and we have at least 400 standard objectives that we use. Mm-hmm. And so we'll see where they are on those objectives, and then they build slowly on one another. And so we're very systematic in the way that we teach one thing at a time, and then slowly build it up until they have really big repertoires of skills.
Yeah, the parents I've talked to, they've talked about how their children have been able to build up their speech, going from being nonverbal to at least being able to be somewhat verbal. Kids have been potty trained when that was thought impossible, and even some things that you don't think about, like using silverware at the table and using a straw.
Right, all of those different independent skills. And what we see is that our kids can learn. We just have to really break the skills down into small steps and then use that positive reinforcement, but also be very careful about the way we provide instruction and make sure that we measure the instruction as we're going. We have a saying in behavior analysis that the learner is always right. And what that means is that if they aren't learning, then we say that we must be doing something wrong, so we change our methodology. So we collect a lot of data as we're moving through, and as soon as we see that the data is working, great, we run with it using our different ABA techniques. But if we see that it's not working, then we immediately make a change. So we're always looking at that data and reanalyzing our different methods.
So one of the things I think that creates this debate about whether Oklahoma and other states should be mandated or should mandate this, that insurance companies must cover applied behavior analysis, is the cost. And I was hoping you could talk about that, and then we'll move to our other panelists, about why it's so costly or can be so costly. I've heard some estimates of up to $10,000 if a child is on like a 40-hour regimen of the therapy.
Well, children with autism, they have a lot of times, there's certainly a range or a spectrum, but they can have pretty severe deficits in social skills, and also independent skills and communication. And a lot of those skills that they are lacking, we kind of take for granted because we learn them automatically. And so when you actually look at the range of skills that needs to be taught, it ends up being a pretty large range and requires some pretty intensive treatments. But it can be done with the right treatment, with applied behavior analysis. And so the standard procedure for providing treatment is a board-certified behavior analyst would do a comprehensive assessment. They would review all the skills that the child has and then all the skills that they need to administer next. And then they write up a very detailed treatment plan. And that treatment plan is actually carried out by a behavioral technician, which acts as kind of the frontline staff under the direction of the behavior analyst to teach all of those skills. But just the number of skills and the way that we have to break the skills down and teach them one by one requires intensive treatment. But it can be effective, and when it works, it really changes the kids' lives.
Hey, Jacqueline, this
yes.
is Judith. Can I jump in?
Yeah, go ahead.
Scott, I'm sorry, I didn't mean to interrupt you.
No problem.
One caveat with regard, am I echoing or are you guys okay?
You're great.
You can hear me good?
Mm-hmm.
Okay. One caveat when it comes to health insurance that's really helpful in the delivery system of applied behavior analysis is just the success of the health plans actually scrutinizing via utilization review and medical necessity. So the way that our laws have been written across the country and passed, the prescription comes from either a licensed physician or a licensed psychologist. So first of all, there has to be an appropriate prescription that meets the rigor of medical necessity that a licensed physician is prescribing. And then the board certified behavior analysts and the people that work under them carry it out. So this isn't just like some sort of blank check thing where people can just get intensive therapy as much as they might think through health insurance. There are layers of cost protection and utilization review built in. And so I think that's important to consider when you're thinking about an intensive program. And you also have to look at the spectrum itself. I have a son who's very severely affected by autism. And when he was younger, he was one of those 40-hour-a-week kids. But many children only need 10 hours a week. Some might need 20. And there are many individuals on the autism spectrum who will never use applied behavior analysis at all. It's not prescribed by their physician. So all those things come into play when true cost is calculated. And so those are just important things to consider when you're thinking about delivery through the healthcare system.
I think those are really good points. Anytime that we have a referral, it's usually through a referral from a physician, a pediatrician or a developmental pediatrician. And they're usually kind of the one requesting the treatment and then really overseeing all of the different treatments that the children get.
Jonathan, could you talk about, one question I had for you was, there's a debate about whose role it is to provide and pay for this type of therapy, and whether it be something that should be covered under private health insurance or whether this is a role for the educational system. I hoped you could talk about sort of that side of the debate.
Well, first of all, let me say that I really appreciate what both Scott and Judith are doing. One of the things that I think important for us to remember is that as time has progressed, actually students that have autism have actually really helped us learn something important, and that's that everyone learns differently. And that's one of the good things that's coming out of the discussion about how to best help students that are faced with autism is changing our educational system so that we understand that people have different needs. I think that there's views on both sides, whether or not it should be through a private health insurance plan or education. What's great about Oklahoma is that through its Lindsay Nicole Henry Scholarship Program, it's actually worked to help and connect school-age students through an IEP, individual education plan, and has connected them with programs like Good Shepherd. And that's not to say that everyone that's challenged with autism has gotten the intervention when they needed it or is even in kindergarten yet. But that is a step and a different approach that's happening in Oklahoma than may be happening in other states.
Could you kind of give us a little bit of context about the Henry Scholarship for folks watching who aren't familiar with it?
Yes. So in 2010, the Oklahoma legislature and the governor at that time, Governor Brad Henry, in a bipartisan way, implemented a program called the Lindsay Nicole Henry Scholarship Program. And what it was intended to do was to allow for dollars that the state was going to spend for children that have special needs, which in order to be determined that you have a special need, you have to have a individual education plan that's worked through with the parent and the student and their school district. And then those families are then able to allocate those dollars that would have been used at the state level to a school or resource option that best the students need. And there's actually been a number of families whose children are using the program and excelling and have autism. And, you know, I think the other thing I also mentioned too is that one of the things we're finding is that while on the spectrum, there's other social skills that those with autism suffer from that we don't, they also have an ability and a knack to acquire and understand some very complex, particularly science or math related issues once they receive help that the typical person isn't able to immediately get.
Can I just jump in there real quick, Jacqueline?
Judith, yeah.
I'm the jumper in there on this conversation. And I agree. I think that providing funding for IEP related services is critical. And I think Oklahoma definitely should be applauded for their innovative approach with the Lindsay Nicole Scholarship Program. And I've actually talked to families in Oklahoma who are benefiting and kids that are doing really well. I think it's really important to not set up a situation though where you have a false choice. I think IEP services are critical, and that's a huge component. But there's still just the whole healthcare piece where a licensed physician or psychologist might prescribe services outside of the school day or for someone who's not in school yet, and they're medically necessary services. So when you look at IEP related services under state and federal law, the goal there is to help students access the curriculum, and that's the goal overall. It doesn't reach the level of intensity that medically necessary care does. It doesn't mean that it's not good and not critical, but it's one piece because autism is really a complex issue. Unfortunately, I know that firsthand, and so with my son now who's almost 12, we've had to receive services through IEPs through the school system, but we've also had to access medically necessary care outside of school, through health insurance. So there's many different pieces. Some of those will sort of be interwoven with IEP services depending on the student, but all that, is just something that we need to look at in Oklahoma. You took such a big first step, but I'll say, there are states like Florida and Georgia who have similar scholarship programs for special needs students who've also now stepped forward and said, in addition to that, we also want to, in our own state-specific way, create some sort of healthcare delivery model for people on the autism spectrum. Their families are paying their health insurance premiums. There really are evidence-based treatments out there, and so they've done both. They're not mutually exclusive. So just something to think about moving forward.
Jacqueline, I spent about 8 years as a school psychologist, and one of our primary responsibilities was to evaluate the need for special education. And you have to identify a disability, but the second federal requirement is this something that is preventing them access to an education? So the educational piece is important, but it only serves children to the extent that we're able to provide them a public education. It doesn't reach outside of the school. It doesn't reach into the more complex social issues, more complex communication skills that the kids need to have. It's just about are we providing the minimal amount necessary to provide them with a public education, and the kids need so much more than that.
Right. Just as a reminder for folks who are watching, you're welcome to ask questions either on our live stream page at newsok.com/live, or you can tweet questions at me at Jacqueline Cosgrove, and I will try to work those into our conversation. One thing I wanted to ask you about, and Jonathan and Judith, feel free to jump in after Scott here. We're talking about school-based services, but I know a lot of the discussion around applied behavioral analysis right now especially is that early intervention and how you can change the way the brain functions early on to have long-term benefits. And Scott, I hoped you could talk about kind of what research is showing.
Absolutely. I mean, the research right now is incredible with brain plasticity. And so whatever you kind of bring to the table, whatever your biology is when you're born, or even if you've had an injury or have a disability, like a neurological condition like autism, that brain structure can change, and you actually can see it change. People have done functional MRIs where they'll look at brain activation before intervention and after intervention, the brain activation starts to look more like a typically developing individual. So they really go hand in hand. The skills and the behaviors that you see, when they improve, you also see changes in the brain chemistry.
Wow.
Yeah, absolutely. I mean, there's some incredible things being done right now where we're really seeing that the limits we used to put on people aren't there, but we have to give them intervention to be able to get it to happen.
And I might jump in there and say that I would totally agree with that. I think the question Jacqueline asked earlier, though, is, who should apply that intervention when I have friends that had dyslexia, and they, as you can imagine, dyslexia doesn't just cause you challenges when you're in school. It can cause people challenges even before they would make it to school. And one of the things that we do have to consider is the cost. In other states such as Florida or Texas, it's often mentioned, those states are mentioned to compare Oklahoma to, their economies are much different than Oklahoma's, both their economies and their insurance market. Texas's economy is 7.5 times that of Oklahoma's. Florida's is significantly larger as well. So you have to consider the cost impact that happens when you do that. I know that in a 2008 study, they found that just for the state's health insurance plan for state employees, that they had a minimal cost of the conservative estimate of $6 million. We've already seen from the Affordable Care Act what happens when mandates are placed on insurance policies to help few that need help, but it ends up having a large impact on those others. And that's why OCPA would say that we definitely need to look at and address issues before school and after school and outside of school, but that a mandate on health insurance plans isn't the way to do that, particularly in a very untenable and shaky insurance market with the Affordable Care Act right now.
I would love to respond to that. And Jonathan, I appreciate what you're saying. I'm originally from Texas, so hopefully all the folks in Oklahoma won't just tune me out immediately. And it's true. I mean, you cross the Red River, and Oklahoma is a beautiful state, but with a very different business climate and population. There are 42 states now. 2008 was a much different picture. There were only about 3 or 4 states at the time that had autism insurance laws on the books. Now we're up to 42. So Oklahoma remains one of 8 that does not have some sort of requirement around insurance for autism. All of these 42 laws do include a requirement for applied behavior analysis and evidence-based treatments like speech and OT. But they've all worked very hard, the red states, the blue states, the big states, the little states, to find solutions that work for them in their state-specific healthcare market. And so that's what this is all about. I'm hoping we can find a way to work together, because the reality is, Jonathan has said, and I've said, and Scott has said, and Jacqueline too, is there are many families struggling to access that level of medically necessary care. Another piece of good news too, and I'm sure this will come up in the coming weeks and months as we try to work towards a solution with Oklahomans, is that the cost that was projected way back in 2008, it's actually, those sorts of benefits have been rolled out in many, many states, 42 states nationwide, and they're coming in much less for many different reasons, because of the spectrum and how diverse it is, and because of the populations affected. So the cost really has come in, the actual claims data has come in much lower than those original projections that Autism Speaks had and that the state, of Oklahoma and others had, because we honestly, all of us, we didn't know how is this all going to look, when we're having, these millions of covered lives, sharing this cost. How's that going to impact? So it's much, much less than it was projected way back when. And I have lots of claims data that I could list off very wonkily right now. I won't do that, but I'll say in all our research in multiple states, it looks like it's coming in right around between 40 and 50 cents per member per month. And that's for a mature benefit that's been on the books for 3 or 4 years in any given state. So lots of other considerations around those numbers, I know. But the projections, fortunately, are much less than they used to be. So hopefully we can have a renewed conversation around that as well. The other thing I want to bring up too is that we talk about the cost and where it should be imposed. The reality is the cost exists. And right now, we talk about big government. Right now, all of the cost is basically being put on the government. So the Oklahoma taxpayer, the farmers, the small businessmen, they're bearing that burden. Their employees are bearing that burden right now. And the private market really has not played a role. And so that's why we really want to talk with them again and say, people buy their health insurance, they pay their premium, and they kind of expect certain things to be covered. I know not everything should be covered, I get that. But when you have something so prevalent that's affecting so many of your covered lives, and there are really important evidence-based treatments that are completely excluded, we're just looking for solutions to try to change that, because it's a big issue. And right now, it's pretty much being 100% taken care of through the taxpayer and through big government. So how can we kind of spread that a little bit and work towards solutions in Oklahoma to change that?
And that's one question. We have a question, or at least 2 questions that have come in. Most recently from Jay Lawrence, and this person writes, I have a son with autism spectrum disorder. He is currently receiving some applied behavior analysis, and we see how it is positively affecting his life. However, we are not able to provide the amount of therapy that he needs and the amount that he would be receiving if we lived elsewhere. As a parent, who should I be contacting within the state legislature to spur changes?
Well, I would say, being an advocate, that you should have a personal relationship with your state legislator. And if you don't know who that is, you can go to autismspeaks.org and click on the advocacy button and then click on Find My Legislator, and you can find out who that is. And I'm sure Jonathan and Scott would say the same thing too. It's important that the representatives, at the Capitol in Oklahoma City, that they hear from their voters, that they hear from their constituents and know the pros and cons of this conversation, because those are the families, that are affected. So definitely find out who your own legislator is at autismspeaks.org and click on advocacy and then click on Find My Legislator. It'll tell you who your federal and state officials are. And I know they're happy to hear from their constituents. They really want to represent their interests as they're going to work every day.
I think what I would add to that is I agree with Judith. And I think that this discussion this time, I know I was at the insurance department and an insurance regulator the last time we really had this discussion in a significant way. And one of the things that detracted from the conversation was really the vehement vitriol that was lobbed at lawmakers and those that were concerned about the costs, and some of the initial bills that were run that didn't have safeguards. And so I think one thing that will help this next conversation is that families definitely with their children are going to have the emotion and the weight and the burden of dealing with their child. But I think that the experts on both sides could be a whole lot more civil.
Yeah, I agree.
And that would facilitate a much better conversation.
I agree. And I'll say too, just working on this nationwide, and I hate to say that out loud, but I am the non-Oklahoman, and I want to be open about that. Although my mom does live in Tulsa. Hello, Mom. I hope you're watching. Although she hasn't tweeted you yet to say how bad my outfit is. No, but I will say too, I've worked all over this country, and it's been an amazing experience for me. And I'll try not to get weepy about this, but first of all, connecting with the individuals with autism, which I think we all agree are amazing, beautiful human beings. And we want to find ways to help them reach their full potential. We want them to be able to speak, to gesture, to communicate, to connect with the world around them. So that first and foremost is the most amazing, inspirational thing for me. Their families are incredible. I'm a family. We're a family. I come from a family myself that is living with the joys and challenges of autism. But the other thing that I've been truly inspired by are regulators and legislators who have had open discussions about this from both sides of the aisle. Because their constituents are affected, they truly want to find solutions. They really do. So there don't have to be good guys and bad guys, and we don't have to yell and scream at each other. We just have to hear each other out and try to find a way forward that will work in Oklahoma for your families in the way that you want it to. So I fully agree with what Jonathan said. I think this is going to be a very interesting conversation moving forward. I'm excited.
Absolutely. I think we all support civil discussion about any topic. I have just a few more questions left, and we'll be looking to see if anyone has any last questions or comments online that's watching. One of the arguments against having an autism insurance mandate is that under federal law, policies provided by employers with self-insured plans are exempt from state mandates. And I was hoping, Judith and Jonathan, you could kind of discuss the issues for self-insured plans and the autism mandate, and if you think there are issues there.
There are, and I would say, I always tell families and legislators and folks that I'm working with that I would love to have a magic wand and just fix everything all at once. But over the past almost 10 years, I've been working state to state to pass laws in the state legislatures around the country. But I've also been working a lot with self-funded plans because although they're regulated by the federal government, and it's very difficult, if not impossible, for a state legislature to pass a law that affects them, just about 40% of the self-funded market is covering ABA now, and that number continues to rise as we see the states pass laws. It's amazing. So right now, for instance, we passed legislation in Georgia this last session, and it took a lot of thought and a lot of hard work on all sides. But I've been spending a lot of my summer and a lot of my time this fall is going to be spent meeting with self-funded companies in Oklahoma who also will be adding the benefits. So although I can't, hit them over the head and say, you have to do this because the legislature tells you to, a lot of times it's just the market kind of takes care of itself, or it's starting to. And as I said, there's a survey that's done by Mercer. They do this employer based healthcare survey every year. And right now it's up to just about 40% of the self-funded plans that are providing an ABA benefit and a meaningful autism benefit. So we're getting there. But I do concede absolutely that the law that we pass in Oklahoma will only affect the state regulated market. But there's a lot of Oklahomans that have those plans, a lot of covered lives, and this is really their only solution. I mean, the health plans themselves in the fully funded market are not adding that product, and they likely will not because of the things that Jonathan has said. They've got a lot of things that they're dealing with, they're over-regulated. If it truly were a free market sort of environment, I think they would add the autism benefit because of the demand and because the evidence is there. But because of the climate that we're working in, as Jonathan was talking about, they're really not going to just step up and do that. And so that's why conservatives, liberals, all sorts of people end up going to their state legislators saying, we really just have to find a way to get health insurance to do this, and we need a law to make it happen. So anyway.
I think one of the things to point out about self-insured plans being able to voluntarily do it is that a self-insured plan can respond much easier to the market than what a fully insured plan can. And so I think that's why there's got to be a lot of careful discussion, and why in the past people have been opposed to applying a mandate on the fully insured plans is because if it's done wrong or if it's done incorrectly, it's very difficult to then make an adjustment just months out of the year, and it's very difficult to get the legislature to come back in into special session. And so, if some sort of law is crafted in a bad way, particularly once people are receiving the benefit of a program, it's very difficult in government to adjust those programs. And one thing I wanted to mention too is that the the private market is paying because the private market is taxpayers, and so to the extent that government's spending any money on what's happening with people that don't get the early intervention that they need, and then that results into a mental health problem that may get someone to the correction system or whatever, most definitely the taxpayers are paying their fair share. And so I think that really the answer is, how do we adjust for and accommodate the needs that there are without trying to further burden the insurance market in Oklahoma. And one of the innovative solutions that we used to have in health insurance was high risk pools, and those were used, and it had government dollars as well to address some high utilization needs without trying to spread an entire risk across an entire market. So I think there's the opportunity to have discussions about maybe where government is spending money and how it could be better applied, and how some sort of early intervention could happen.
We have one comment, and then we'll probably have to wrap up, from Trent England, who I believe is one of your colleagues, Jonathan. He's the Vice President for Strategic Initiatives at Oklahoma Council of Public Affairs. And he writes in, if, quote, not everything should be covered, quote, where is that line? What is the difference between a condition where you believe you should be able to force other people to pay for care and a condition where you would find that immoral? For mandate supporters, please explain where you draw a moral line.
I would say, the moral line is drawn by having conversations like we're having. I know there have been conversations in the past around cancer treatments and other things, and we've had to go to our leadership, to our legislators, to regulators, to people from different interest groups to find that together. And so the autism community is definitely requesting that consideration, and that's why we have the democratic system that we do, to work through and find those solutions. And I would say in 42 states across this nation, all of the surrounding states around Oklahoma, the legislature has come to the decision that the morally appropriate and the fiscally conservative thing to do is to move forward with reform for autism insurance. So, it's something I think that Oklahomans would be rightfully served for the legislature and for policymakers to really look at and consider.
I think the thing that you do have to remember is that when we're talking about this issue, it's mentioned that it's growing, and the number of students that we're aware of that have autism it's becoming more and more known. So the question is that we have to be, I think if we're going to be honest about, as a society, ask that question is, one, why is that? And then two, what can we do to move these types of therapies into a manner that it's not just a few that can perform them at a high cost? And that's a serious discussion that needs to happen. And then the second thing is, I think we do have to be very aware of the Affordable Care Act has shown us that there is a limit to what you can promise and effectively achieve without significantly burdening the economy. And I mean, the fact of the matter is, from the Affordable Care Act, health insurance policies now for single people are significantly more, 100% to 200%, depending on what kinds of coverage you need. So, that's all going to have to be walked out over the next several years, not just as it relates to autism, but any other medical necessity that we would have considered before 2009 and 2010.
I think Jonathan brings up a really good point with regards to just having a few practitioners available that and it ends up being kind of a high fee service. Right now, we're training practitioners and we're getting people certified, but unfortunately a lot of them are leaving the state. I mean, they can go to another state and make a living, doing what they love and helping children with autism, but without the coverage here, it's just difficult to make a living here as a practitioner.
Well, I want to thank everyone for joining our conversation, our three panelists, and also those of you who joined in and commented online. Obviously, this is a conversation that will continue throughout our state and that we'll continue to write about. So with that, I thank you all for joining us, and we will wrap up our conversation. Thank you.
Thank you, everybody. We'll be talking.
Absolutely.
All right, thank you.
Thanks.
Thanks. Good to meet you guys.
You
Good to
too.
meet you too. Bye-bye.